which is the online debate and discussion on the theme leveraging research and development and innovation capacity to combat COVID-19. So very close to the pharmaceutical discussion that we had, but then on a different level. The speakers will be announced by Vidya, our moderator for the program today. And again, I would like to thank Ambassador, and I would like to give the word to Vidya. Please, Vidya, the floor is yours.
Yeah, I will say farewell because I have another meeting with some colleagues here. So happy to join next time. Please let me know. Very much enjoying this kind of discussions and debates. And well, if there are any individual companies, let me know if there's an issue where we can help. And well, see you next time in a joint meeting. Virtual, I suppose. Thank you so much, and stay healthy.
Thank you very much.
Yeah.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Okay. Thank you very much, Edith, and everybody else who joined for this first part of our session. We are running a little bit late. We'll try and extend a little bit into our networking if we need to. I would like to start by welcoming our guests, all three of them who are joining us from India, our three speakers, and in a minute I'll introduce them. So yes, today we are going to talk about how companies that are active in the India-Netherlands business corridor, as we put it, have leveraged their innovation capacity, their R&D shops, if you like, to combat this unprecedented crisis. And just an interesting thing, crisis in Chinese character is denoted by two brush strokes. One means danger, the other means opportunity. And we may think right now whatever we want about the Chinese government, but the wisdom of this looking at crisis as a danger come opportunity is, of course, stands beyond question. And in this sort of combination of danger and opportunity, it brings out the best in people, sometimes the worst, but luckily a lot of the best. It pushes you with adrenaline to reveal new potential that you never thought you had before. And the same thing applies to organization. So let's talk about it today. Listen to the stories of three exemplary companies and their amazing work. I would like to start by introducing Shankar Som, who's our first speaker. Shankar, who I'm also proud to say is my colleague at Tata Consultancy Services, joins us from Hyderabad. He's the Chief Innovation Evangelist there, a very select group of people who are talking about innovative solutions across the globe to different companies. He is a R&D and innovation man with many, many years, almost 2 decades of experience. And what's probably most interesting is that he is looking at how innovation as a discipline evolves and how best it can be used to the benefit of organizations and humanity at large. So Shankar, without further ado, I'm going to invite you to take the floor. And as I understand, you wanted to start off with a video. At this point, I'd like to request Patricia to maybe help you with the logistics of that.
Thanks, Vidya, and thank you for having me on this panel. It's a pleasure to be here. So I thought, what better way to talk about TCS's research and innovation response, but not limited to research and innovation, but also show how the organization prepared itself for making sure that business continues and its people are safe, and we handle the responsibilities that are given to us by our clients with the same level of responsibility that we do in ordinary times. So we have a very quick 2-minute video. It was produced for our clients, but I'm happy to just play it here because it will give you a good flavor of what was going on when everyone was adjusting to the new normal. So Patricia, over to you.
even. Maar nu, ik krijg hem niet uit. Ik krijg hem er niet uit.
Okay. Patricia, just continue. We can just proceed. Technical glitch, guys, happens.
Yeah.
Okay.
So we're all used to it, dogs barking, children running. So, and videos playing without any sound. So, as I said, you know, I was actually happy that it had some teletext on it, but let me just, you know, let me just take you through the ugly details of, you know, what this video was about. So for those of you who don't know, India went into lockdown somewhere around the 22nd of March. And as enterprises, you know, as global businesses running out of India, a company like TCS had about 6 to 8 hours to respond to the lockdown, which meant making sure that about 450,000 employees and about 96% of the 450,000 employees, we needed to make sure that they're able to work from their homes. And the first thing that was in the minds of the management and, you know, and the leadership was the safety of the employees. The second was the fact that we deal with a lot of confidential data of our clients from, you know, various business processes for our clients that we manage. And it was making sure that that guarantee of trust and the guarantee of security of their data was maintained. And the third, and I would say in the pecking order of importance, was making sure that we as a company could keep our lights on and our business on. But the safety of associates took the primary, you know, the primary focus for the leadership. Now, what did we manage to do? We managed to move 96% of a global employee base of 450,000 safely and securely to enable them to work from their homes. You know, in the first month itself, we had to move 26,000 project teams, and these 26,000 project teams had to meet about 35,000 times through online meetings virtually to make sure that the business didn't suffer. And we were just looking at the data, and you know, just during the first month of the lockdown, we had about 400,000 calls that were made, you know, point to point between employees. So that was all the gory detail of, you know, what was going on. And we are very happy to say that, you know, we could move our employees safely. And we could also make sure that there are about 1,000 global companies today whose critical operations TCS manages. And we will make sure that none of those operations suffered because what was going on in India and elsewhere, and our employees moving into their homes. So that was all the gory detail of what was happening on the business side. But I'm here to talk about the research and innovation response. So just by way of introduction, I am the chief evangelist for TCS, which means I am the interface between our research and our business units and our customers. So I thought I'll take a little bit of a different spin when I talk about the TCS research and innovation response. And I thought maybe I'll go into the little bit of a, you know, the ugly business of innovation that nobody talks about. You know, that you know, everybody focuses on outcomes and all the so-called cool things that, you know, the world sees. But behind the process of innovation are the ugly details, and I thought I'll just maybe surface some of them. So we started a formal research and innovation response on the 25th of March. And we were very clear when we started that response that we will start it and manage it on a scale which is extremely industrial, and make sure that we treat this response with the same degree of seriousness as we do to any other business response or business project that we manage. So we set up a dedicated program management team, and I'm happy to say that we continued this initiative, the formal research and innovation response for about 2 months. We wound down the response on about the 25th of May. And in those 2 months, there were about 63 projects which were spawned. And these projects involved about 16 business units from TCS, which actually came together. There were 28 partners, external partners with whom we collaborated in formulating this response. And we did a quick calculation of the amount of effort that was put into this response, and it was about 10 person-years. And the program itself was structured so that we had 5 clear categories of interventions. So the first category is essentially taking existing products and platforms that we had and adapting them to meet the challenges posed by the COVID-19 pandemic. The second dimension of the response was what we called rapid prototyping based projects. So these were essentially projects which were born out of an idea, which was very contextual and had to solve a very specific need during the early phases of the crisis. And there were teams which were rapidly prototyping these ideas and building them into these minimum viable products, which then had to be released either to society or to enterprises or even internally within TCS, as we would any business application, right? So they had to be stable, they had to be secure, and they had to actually do what they promised. The third category was the research response, and the research response was around how does TCS Research as a community of scientists make a contribution to the global scientific community? So there were several projects, about 20 of them, and I'll talk about a few of them towards the end, which actually were spawned and which had a lot of impact on the global scientific community. The fourth category was what we called community contributions. Essentially, these were TCSers from the research and innovation fraternity, who on their personal basis were contributing to projects that were floated by other people and external stakeholders, but they were making quite meaningful contributions, and we thought that it's important that we recognize and we keep track of that. And the fifth category was the technology transfer category, where TCS was sort of acting like an extended arm, a global arm of the Tata Group, and making sure that we were enabling acquisition of technology, especially in the area of PPE, for technology transfer to the Tata Group companies in India, who could then manufacture them at scale from a purely charitable purpose and make sure that the government was adequately prepared to handle the crisis. So I'll just quickly finish by talking about a few specific projects. Let me just start by talking about the research projects. So 4 or 5 research projects are very important to mention. So the first was a group from a life sciences research team actually looked at a billion-size database of small molecules, and they had a little bit of an idea about the COVID-19, the virus, the coronavirus, and the structure and the properties of the proteins that this virus attacked. And they were able to find about 31 compounds which had potential properties which could help scientists design drugs using those compounds. So that was quite noteworthy, and we actually then collaborated with the Indian government, especially an arm of the Indian government called the Council for Scientific and Industrial Research. So that's like the DARPA for the government of India, which essentially controls a lot of the government research spending in India. And we made sure that those compounds were transferred to the scientists working in these Indian establishments. And then they started the wet lab experiments through which they could establish the efficacy of these compounds. So that was one. The second was we also quickly adapted one of our existing research projects, which was looking at classifying skin diseases based on images of patches of skin. And we quickly converted them to making sure that we were able to look at lung x-rays of COVID-19 positive patients, and then develop machine learning based classifiers, which could then look at lung x-rays of patients who report to medical centers and hospitals all over the country. and use simple lung x-rays, which are extremely cheap in India, and make sure that we are able to use that as a way to classify. So a lot of the early work has been done. We are opening up some APIs so that the government can use them. And we also made a lot of contribution from a research perspective to the global scientific community in general. So for example, Kaggle, which is a data science crowdsourcing initiative by Google, the Allen Institute ran a challenge on parsing biomedical literature and extracting entities from biomedical literature, which would enable scientists to actually tackle the large volume of COVID-19 related scientific literature, which was being thrown out in large numbers. So a team actually quickly put together a text mining tool, which we then submitted to the global scientific community through the Kaggle challenge, and so on and so forth. So that was one category of initiatives. The second category of initiatives, some of them which we treat as individual contributions, was also extremely interesting. So we have an initiative which we run in the city of Nashik in India. It's called the Digital Impact Square. And what that initiative does is it's run by a foundation, but a lot of TCSs actually spend quality time working with the foundation initiative. And there what we make sure is we've created sort of like a social entrepreneurship accelerator where ideas from society are quickly prototyped by teams, and the city itself acts as a virtual laboratory in which those ideas are tested. So some of the interesting things we ran there were, I don't know how many of you have seen videos of the lockdown from India, but the Indian police gained a lot of notoriety in making sure that they enforce the lockdown quite vehemently. So if you were an ordinary citizen in India, you actually have to be on your tenterhooks if you ventured out without a valid reason or a pass issued by the government. So what this this incubator there, a team of social entrepreneurs, came up with this neat idea of generating QR code based electronic passes, and they quickly collaborated with the government of India, and within 3 weeks they put that solution out into the hands of the government. So it's a workflow based solution where somebody applies for a permit, stating valid reasons. It flows through a series of workflows where an authority says that yes, you can have that permit. And then a QR code is generated, and the cops also have the same application. So when you actually show the QR code, when a cop catches you and asks you, where are you going, Mr. Mr. Violator, then you just show the QR code and he's able to just scan it and he says, yeah, that's a valid one, right? So I'm very happy to say that within 1 month of that going live, we had about 2 million electronic certificates issued for allowing people to move during the lockdown with valid reasons. Another team out of our Singapore business actually built an app. It was called the Digizen app. It was built for the government of Singapore, and essentially it was a one-stop shop where all lockdown-related information was available through one single mobile app. Right? It had information for kids. It had information for parents. It had information for people who were not feeling safe, who were not feeling well, and had symptoms, and they want to check those symptoms. And so it was like a gigantic aggregation of reliable information, all available through a single app. And again, that was also put together in extremely short timelines, about 3 weeks. In fact, a team from TCS Europe participated in the EU versus virus hackathon, which was launched by the European Union. And they actually stole the award when it came to creating financial solutions for distribution of government aid during the crisis. So there were a lot of these individual contributions which we made, and from a product perspective, we're coming to the really serious business. So the government in India had put together a lot of these empowered panels directly reporting to the PMO, the Prime Minister's office. And TCS actually made a lot of contributions to some of these panels, and I'll talk about a few of them. So one of them was about when the crisis broke in India, we did not have a very accurate understanding of the healthcare supply chain, especially when it came to PPE, right? So imagine a situation that somebody who was tested positive or has symptoms walks into a primary health center. So there is this whole value stream behind the masks, the gloves, the ventilators, the respirators, and we did not have a very accurate picture as to who was manufacturing, the tier 1 manufacturers, the tier 2 manufacturers, and how many of those endpoints existed outside of India in other countries. So it was a gigantic task, and we actually collaborated with, again, the Council for Scientific and Industrial Research to put in place a quick app which could actually help us quickly map together that value chain, because that became extremely important from a risk containment perspective. The second large initiative from the government that we were involved in was, India is a little bit like the EU. We have a lot of states, as do you. And there are certain subjects which are state subjects. So for example, healthcare is a state subject, which means that the data that the state government collects about your health cannot be shared with the central government without the adequate checks and balances, because it's a state subject, right? So there was a need to put together a health data exchange where the various governments, state governments, could actually collect and share data with each other through safe and secure means. And TCS was also involved in, essentially we had a data marketplace product which we were taking to market. And we started working with the Empowered Committee, which was actually driving this large integration effort of creating a data exchange for health data within the government circles. And we are right now trying to provide the critical infrastructure on which some of the data will reside and be exchanged safely and securely. So I think a lot of activity, Vidya, so I'll just stop and...
Yeah, let me break in also from the point of view of time. So really good overview of your 5 categories, from research to community and rapid prototyping, etc. So let's come back to that in the questions. I'd like to immediately move to our next speaker, who's Ravi from Philips. And we're very, very happy to welcome you today, Ravi. We've had a couple of chats, and I know you've been doing some fantastic work. So Ravi, ladies and gentlemen, he's the head of health system, working out of Philips Innovation Campus in Bengaluru. And he is someone with over 3 decades of experience in R&D, huge amount of hands-on experience in covering all aspects in the health systems. And today he's going to tell us maybe a little bit personal story of how Philips and his department, especially, or his organization, geared up in the face of this crisis. Ravi, the floor is yours.
Thank you, Vidya. I guess I'm audible now?
Yes, very much.
Good evening, good afternoon, good evening, participants and NICCT executives. Thank you for giving us this opportunity for sharing my 2 cents of how we actually are dealing with this COVID crisis of sorts. I think Philips was slightly proactive in terms of anticipating and managing this. On the 13th of March, we had what is called as a dry run, saying, what if all of the 5,000 engineers that we have in the Philips Innovation Campus in Bangalore were to work from home? What would it actually mean in terms of VPNs, in terms of the networks, in terms of the bandwidth that is needed to ensure that the servers get connected to the configuration files, the databases, whatever that needs to be accessed? How is it actually going to work? And that gave us a couple of days to sort of tweak our actions to ensure that we are prepared in case the worst sets in. And that is exactly what happened, because on 18th of March, Philips decided that we are going to have people work from home, all the 5,000 of us, given the fact that employee safety is of topmost concern to us. We were very, very sensitive to it. So even before the government declared the lockdown, Philips had already planned for it. And we said that we are going to go work from home and ensure safety of employees and also safety of customers. We never anticipated that this will extend so long. But then as we could see into the horizon, things getting extended, we were also sort of trying to work on it and prepare ourselves. In fact, we had a task force created, a BCP task force created, which would meet every day for about half an hour to decide where are we with respect to the issues that the people are having, what is it that we need to resolve, and how are we going to take care of their ergonomic needs? How are we going to take care of their emotional well-being? How do we ensure that the customers are safe? How do we ensure that the productivity is there? The certain commitments that are made to the customers in these trying times have to be met. So how are we going to do that? How are we going to ensure that the mental well-being is also sort of taken care of? How do we ensure that people, that the social fabric is not lost? How do we keep them connected? How do we have informal sessions wherein we come together for a virtual cup of tea with friends and family? So we had multiple task forces working on discrete areas. And at the end, I would say that in some cases, we also moved equipment to their houses, because as the lockdown got prolonged, we felt that from an ergonomic issue, it would not be possible to work always from the laptop. Now, these guys had desktop in their offices. So we said we will move all the desktop to their residences and ensure that they almost create a home office of sort, so that they are as comfortable and ensure that the productivity and the continuity and the delivery that we have committed to our customers the integrity is maintained. So that was something that I think I personally, me and my team, we take pride in this. And thanks to a leadership of Kalavati, I think it made a lot of sense to do what exactly we have done, and we are planning to continue this. Now, this is as far as the personal aspect goes. Now, where are we in terms of ensuring that the societal care is also taken care of? Like, for example, let me give you a couple of examples as to how we were able to come up with innovations which would have taken at least 12 to 18 months. We were able to compress that to a few months, to a few weeks, if not a few months. So, like, for example, we talked about, let me sort of give you certain examples there. We have a product which is called as an eCare Companion and an eCare Coordinator, by which clinicians can connect to patients using two-way live video, allowing an accurate assessment and gaining insights into the patient's living environment by monitoring and looking at, shall we say, their vital parameters. So what we did was, we said video consultation is something that we are going to accelerate. The web application was expected to accelerate the deployment to the patient, and it would not require shipping a device, tablet, or anything of that sort. This was basically the first step towards bring your own device. Not only that, we also said we will integrate third-party education content into our ecosystem, so that the patient education on various medical conditions are sort of transferred to the clinician as needed. We also went ahead and we integrated what we call as a biointelligence patch device for continuous monitoring and measurements of parameters for COVID-19 patients. And of course, we also went in and created COVID-19 specific care programs, protocols, and content devices, such as surveys, which were basically driven by AI backend to ensure that we are able to do a pre-screening of the patient and provide him red, amber, green sort of a symbol, which basically helps him in terms of taking a call whether he should go to or see a doctor or take care of the house itself. That's on one part. Now let's look at remote care in the sense that we look at, we have a product called as IntelliSpace Consultative Critical Care, by which you can remotely create a sort of ICU type capability between a hub and a spoke. Now, this was something that we had to sort of reformat the product that we had and come up with a solution that would be specific to COVID-19, because in India, what had happened was there was shortage of hospital beds, and they were planning to convert trains into hospital beds. So what we wanted to do was to install these systems in the trains. So it required a certain amount of modification, and we were sort of working hand in hand with the government to make this happen. The third one was in terms of empowering radiologists. Now, the radiology department in Delhi on a Friday evening called us saying that we had an application called as IntelliSpace Portal, which is basically has post-processing applications to see image of lungs and then do sort of diagnosis on those images. So it was a Friday evening when the team first engaged with the market colleagues, because there was an urgent need to help the hospital with the provision to view and report advanced visualization studies, irrespective of the location. And also you had to keep data security and privacy in mind. we had to ensure that the supply chain mechanism was activated to ensure that the portal reached the hospital on a Saturday afternoon. On the customer side, he ensured that the VPN connectivity was provided, the network was secured. We had the entire team of PIC, R&D guys, field engineers, service engineers, the customer support executives, the clinical application, the sales specialists, all of these, along with the hospital staff, all of them came together as one team. And by evening, we ensured that the solution was live and the doctors were able to screen patients and report on them. So this was basically the question of how do we go and save lives. Now, when we move on to the consumer side, we have what is called as a Pregnancy Plus and a Baby Plus application. So what we did was to introduce new content in the feed screen of Pregnancy Plus and Baby Plus apps to give the awareness to the users on COVID. It was about what was coronavirus, how does it affect babies and pregnant women, what are the symptoms, what precautions needs to be taken. And this was basically more focused on the UK market. The information on the new content card was country specific, and so that it could be modified with respect to the country trends the moment that they needed it. Not only that, I think the India team, along with US, Israel, Eindhoven, and China, came together to develop AI tools, which was specifically working on the IntelliSpace AI work suite that Philips has. And we also sort of opened it up to the ecosystem so that they could use these for doing further diagnosis of X-ray images to see whether they were impacted by COVID or not. So in that sense, I think it has been a broad-based approach. It was not only for Philips, but also for the entire ecosystem that we were working towards, because these sort of pandemics, as you said, Vidya, there's a danger, there's an opportunity, and what we would want to look at is the opportunity that it brings to us, more so in terms of galvanizing the whole ecosystem as a team to come and fight this monster and see what we can do to impact and make a difference to people's lives. Philips' stated ambition is to touch 3 billion lives by 2030, and I'm sure these efforts will help in a small way in achieving the vision outlined by Frans van Houten and the entire leadership team. I think I would pause here and take any questions if you have.
Thank you so much, Ravi. Fantastic. And it's so humbling to realize that sitting with your 5,000 engineers in their improvised home offices, etc., you probably have had impact on millions of lives. I mean, that's just to contemplate that, you as well as Shankar so far. What we can do is, and I don't see any questions coming up immediately, so we can proceed to Ashwini and then take all the questions together after his presentation. So along the lines of the great stories that Shankar and Ravi have shared, we'll talk now to Ashwini, who represents iMedrix. And here you really get into the nitty-gritty of work on, hands-on and on the groundwork, because iMedrix is a company which is a scale-up, so apparently also with Silicon Valley roots, which I'm sure Ashwini will tell us about. But they are looking to deliver specific solutions which can be used in devices, and solutions which can be used in the contactless sort of new reality that we have to face in the COVID time. So Ashwini, I'm going to hand it over to you. And if you can tell us your story, and then we can go to a discussion. To everybody here, please do send in your comments in the chat box or questions, and we'll pull you in one by one to have a discussion. Thank you. Ashwini, the floor is yours.
Thank you, Vidya. And likewise, I think it's a great opportunity to be able to talk to all of you and the wider audience there. And we really thank NICCT for the opportunity. From our perspective, what I'll do is I'll just run a couple of slides as I speak, and then I can switch back to what we are really, so people get the context of what we're doing right now. Just 1 second. Can you see my screen?
Yes.
So we are Silicon Valley headquartered, but from the context, let me tell you that we are in the middle of it. Our teams and supporting the real warriors, the healthcare workers, We're right in the middle of the COVID situation. The context is that we are specialized CHD, coronary heart disease and a cardiac disease assessment platform. Essentially, what you see are some of the staggering numbers, which everybody knows, but we kind of forget about them as we go along. In reality, this epidemic has been around even before the pandemic came. And the other very big reality is that the pandemic is affecting more the people who are actually the victims of this epidemic. So from the numbers that you would see coming from American College of Cardiology or reports coming out of China or even Europe for that matter, that almost 12% of fatalities from COVID are not happening because of influenza. They're happening because of people's cardiac condition becoming acute, which is absolutely shocking. There's a whole draw out there where people are talking and the papers published about what happened to all the heart patients who were actually queued up in corridors for tests and interventions, and they're all gone. Nobody's there. And the reality is people are actually dying at home because they're too scared to go out there and get themselves, treated. So what we do essentially, Vidya, is that we are under 3 years, like you rightly said, we are a scale stage company. Probably one of its kind, real-time IoT ML solution, which is like a 30, 40-second ECG anytime, anywhere. It immediately gets ported onto a AI algorithm, which within a matter of minutes, actually it's less than 3 to 4 minutes, is able to send back a severity analysis for the heart condition. And all this could be literally anywhere. We are doing, our teams and our partners are running cardiac screenings under the trees camps in Nigeria, in Kenya. We are present in 15 countries, like I said. We are in the Philippines, we are in Malaysia, Indonesia, Myanmar, Cambodia. It's a significant, gratification to see. I can tell you a number. If you look at the 155,000 people we have touched over the last 3 odd years, we're actually saving anything between 8 to 9 lives every day. And these are people who do not know that they actually had a cardiac condition. These are all asymptomatic. People like me, a lot of other people who believe we are completely healthy. For every 100 people we touch, there are 14 people who are carrying a risk, and out of which 4 people have an imminent risk. So the reality of the situation is that, what it got based on and triggered from, that it is not really saying, it is a cardiac screening product. It is revolutionized, and the innovation is how you are doing it, which essentially means it's compacted, it's completely integrated, and it's truly a world innovation where you can carry it in your pocket, and that's what we are currently at. So given that context, it is also great to know that the big change we have done, and which we triggered out of the current COVID situation that I'd like to bring up, is that when we came to know, and we already have a footprint in 15 countries, the moment there was a FDA enforcement guideline to start using remote patient monitoring or similar tools that use significant AI and ML algorithms to actually refer the severity of a patient's condition. And this is where we think our ability to switch gears and pivot very quickly came in very handy. So CardioScreen, essentially, which is our core product, is potentially today the only product where a nurse or a caregiver or even a family member at home can actually take an ECG and get a doctor response back within 5 minutes or even less than that, by being up to 4 to 6 meters away from the patient. That is the big part. That it's virtually out of the contact distance, which is supposed to be the propagative distance, which is where it became a significant impact for the caregivers, for the doctors, because essentially every caregiver or doctor or nurse getting infected impacts anything between 20 to 100 patients, and they cannot be out of action because they are the people who are actually making a difference out there. And that's where our real, pivot for innovation happened for COVID, that we were able to now deploy, which we are now available, like Ravi mentioned earlier, in the train compartments in India, in Malaysia, with our partners in the Philippines. We are using it in Kenya, and we are now rolling out in the community clinics in the United States, where patients are actually told that unless you have a serious emergency, please do not come to the clinic. So they're extending this facility to actually screen patients for any kind of cardiovascular risk assessment in their homes, or they're actually sending the caregivers to people's home. From an impact perspective, where we are today, I think the math is progressing towards a horizontal where what we are seeing is that we will move from just a cardiac condition all the way to the trifecta, which is hypertension, diabetes, and cardiac disease, and move to a medical grade personal health monitor, which anybody can carry. Because today what you see on wearables, which is the likes of Apple Watches and so on and so forth, and multiple other devices, they're very consumer centric, and they do not add, or I may say in the doctor's own word, that they do not add any value to a doctor's ability to assess your condition. So what we are moving toward in the next 2 to 3 years time is that we will be a completely medical grade personal health assistant, which everybody can carry in their pocket. So I'll stop there and take any questions from here on. Thank you.
Thank you very much. That's really fantastic to hear that within a very short period of time, you can actually create what is essentially a possibility of self-administered ECG, which people can conduct in clinics, quarantines, in their own homes with some guidance. And if I understand you right, Ashwini, there's also a predictive component to it. And now I'm worried about my heart, because many of us don't realize that we are actually not that healthy as we think we are. But in any case, jokes apart, it can predict and actually pre-screen riskful cases, as I understand.
Yes, that's absolutely correct. And the fun part or the interesting part is that the doctor could be anywhere. We've had people reporting out of another country, and the response time is still under 5 minutes. So you could literally be anywhere. And because in the current situation where people are actually scared about going out and getting any contact, even if it's for a genuine illness, this has become a really very powerful message. And I think it's also established, while, I mean, I wouldn't say, we are the only one. There were a lot of innovation happening around the world, but I think it's been a wake-up call for a lot of people and a lot of companies to actually create products and platforms which allow you to do a lot of self-administration. Also, because I think by nature, all of us give responsibility of health to the doctor, right? This will probably make us more self-reliant to actually say we need to first take care of ourselves instead of just, burdening the doctor, who are actually way better placed in creating, or servicing the needs of critical patients than to do just, basic things. So I think that we think is a very strong message. So happy to take any question. Thank you so much.
Great. Thanks a lot. Ashwini, I predicted you'll get a lot of questions as to when you're opening an office in in the Netherlands. There you have it. I leave you to answer that.
Yeah, so
yes,
sorry, the ambassador spoke earlier. So, I mean, my simple answer is, I'm keeping a track the flights the moment they start, and you'll see me there.
Very good. That's what we want to hear. And we want you as a member of NICCT, goes without saying. But absolutely. I have a very nice question from Alfred. Yes. So Alfred is asking, and I think this goes as much to all the speakers, although he addresses it to Ravi, as to, from your perspectives of having provided help and succor and support in this time, there are fears, and all of us have them for our families everywhere in the world, of a second wave of lockdowns, etc. So would you like to take the question, starting with Ravi and the others? How do you view, of course, nobody can predict fully, but how do you view and how can we best prepare?
Yeah, I think what we need to brace the fact is that, at least in India, based on what I see here, with the easing down of the lockdown and a lot of the movement of the migratory labor force from one point to another, I would expect, and we are seeing for sure increase in the numbers. The numbers are not going down by any stretch of imagination. So from my perspective, and this is my personal assessment, I would expect to see this rise for another 3 months before things start sort of slowing down, and we get a control in terms of what the disease profile is actually going to be. And I'm also hopeful by then we would have some vaccine of sorts which will help us manage this going forward in a better way. But then you look at history, you look at, say, World War II, where the women force come onto the mainstream. You look at 9/11, security took a very different stand. You had the Alibabas coming in China. So these sort of pandemics or these sort of, shall I say, events are defining moments for us. It is going to be a new normal for some time to come, I would see. And the question is, how can we ensure safety of our family, our colleagues, our staff, and our customers? And therefore, innovation has to be sort of a constantly going activity. And not only that, I think what we are also, what is actually happening is all the corporates and everybody coming together to form one team and opening up to the ecosystem, like what Shankar talked about, opening up APIs. Now, that's the way that it's going to happen in terms of how can we collaboratively deal with this disease rather than any one of us taking it individually. I think these are defining moments for us, and I think this COVID is there to stay, at least for the foreseeable future.
So Shankar, let me take the question to you now. You made a parallel with India sort of being similar from a geographical perspective to Europe. And now we know that Europe is opening its borders. Just like in India, the healthcare is a state, so in this case, EU member state mandate, and they will have to share information on who is contacting whom and who is tested or not, etc., when they are traveling across borders. So how do you see this working out in, let's say, the second lockdown? Hopefully not, but in any case in the future.
Right. So, I mean, interesting question. There's no easy answer to that. See, I'll just share a personal perspective. I think somebody asked the question, you know, what does the long-term situation look like in India? And I'll just give you my personal, you know, story. We were under lockdown up until about 2 weeks back. I live in a large community, which is essentially, you know, several residential towers. So it's self-contained. So we had 0 cases for the last 2 months of the lockdown. But the lockdown opened up about 2 weeks back, and just 3 days back, one family in one of the apartments in our complex, they tested positive. And we are again back to the lockdown. As a community, we have put ourselves at the lockdown. There are about, you know, about 1,500 families that live here in this community, and we have all again gone back to the lockdown. So I think this opening up and again, you know, starting, restarting, locking up, and again restarting and reopening, I think that's going to be the norm for the next few months. And you know, when I think about vaccines and you know, and medicines and cures, I think this has been an extremely, I mean, there are a lot of positives about this crisis, and I think it's worthwhile to highlight that. See, when the SARS outbreak happened in China, I think it was about 15-18 years back, 2002. By the time the viral genome had been sequenced and had been put up for the world scientific community to actually look at and find a cure or do some analysis at least, it was several months, if not years, right? But in this case, the SARS-CoV-2 was first synthesized, the sequenced in China in the 2nd or 3rd week of December, and by January 16th, it was available online for the whole scientific community to actually look at. So I think this is, so I think we've got much better at this, and I'm very, very hopeful that this is just a passing phase, and in a few months, if not, you know, if not a bit longer, we should soon see the last of it. And I think it has moved all of us to what many people are calling the new normal, but we in TCS are calling the new beginning. You know, going back to your thing about the Chinese, you know, the alphabet or the word for opportunity and crisis, I think we are looking at it as an opportunity. And from a TCS perspective, we have decided that, you know, we have a 25 by 25 policy, which essentially says that in the next few years, only 25% of our employees are going to work out of offices. So I'm looking forward to that. I don't know about the others, but but as long as the kids stay in school, so I'll make that. Fine. So over to you, Vidya.
Yeah, thank you very much. No, indeed, I think we've all had to deal with our children at close quarters, and that has had some interesting effects on all of us. So thank you for that. Just going to Ashwini for a quick question. If you look at, if you would describe sort of an interesting use case, again, I want to pull it a little bit to how this self-administered ECG would work in an actual practical situation. That, you know, a call comes in somewhere, somebody is in crisis. So how does that actually work in terms of using your device? Because I think right now all these, it won't restrict itself to this particular condition, cardiac condition, and maybe not the ECG, but a wider range of applications.
Thank you, Vidya. Frankly speaking, there is always a need for some kind of assistance. Not so much that somebody needs help, but typically when you are elder, and we're looking at typically senior people here, right? Because most of the time this condition, you know, prevails and happens over a period of time when people are older. So for them to be able to deploy the electrodes themselves kind of sometimes becomes iffy. But we've tried it with even 70, 75-year-old in the US, and they're able to do it perfectly. So the interesting part is that there is nothing to be done on the device, actually. It's just one single button. It's the size of maybe an iPhone 8. And all you need to do is just place the leads the way instructed. There's something called a small heart chart, which is like a 4x8 chart next to you.
If I may interrupt, I just want to understand if let's say, you know, God forbid, but let's say somebody in my family is looking, you know, in distress, and I make a call to
Sure.
wherever. What happens then? I mean, yes.
Sorry, go ahead, complete your question.
No, that's it. I mean, I just would like to understand, you have a device and it has this capability. How does it work in practice? I don't know if others are interested in this. I was just trying to understand.
From service perspective, then, so there are markets where we work very closely with the service provider, and there are markets like India or a lot of other markets where the hospitals or the clinics are buying it, right? So your best approach is you have to talk to your doctor, or if you have a service provider locally who can actually send somebody home to get the right there and that. So it's as simple as that. So obviously you need access to a care provider. We are not consumer yet, but hypothetically speaking, if somebody wanted to buy it and use it for themselves, it works as beautifully. There's nothing to be done because it just works on an Android app, and all of us have perfected, you know, learned from our children actually to use, you know, tablets and mobile phones who are brilliant. So there's nothing to be done on the device besides one single button. That's about it. Everything happens in the app. The app is error sensitive, which means it tells you actually V3, which is a particular lead near the heart, and L1, which is right limb, it will show a red, which means it will not proceed with the ECG. You can probably press it and fix it one more time and then go. So it's completely, in terms of its user experience and its outcome, it's as good as it gets. So it actually tells you, and then it will capture the ECG. You just need to save it. And the moment you save it, it automatically goes to the cloud. It gets processed, and within a matter of 15 seconds, you will get your severity alert. It is not a diagnosis because that's how the FDA regulates it, because you still need a cardiologist to review it, but it'll actually tell you, it actually will tell you what is your heart condition.
But does that mean that if the hospital gets the message that they can then take a call with the severity, how to deal with it, send an ambulance, not send an ambulance, etc.?
On the dot, absolutely. So it gives you a green, yellow, red. So you actually know.
It's more like an, if I may
Yes, go ahead.
So if I may interrupt, it's more like a warning signal.
It actually presents you with the potential ailment or the condition of the ailment, even if it's a particular ventricular problem or a valve problem. But it's for the cardiologist to make, because it cannot be assessed, a cardiac condition cannot be assessed by one single parameter. So they will make a lot of assessment. What is your age? Have you had a cardiac condition before? Do you have family history? Are you overweight, right? Do you have hypertension? Are you diabetic? So that's why you need a cardiologist to weigh multiple other things.
Okay.
But as a first gatekeeper, it tells you have a problem or you don't have a problem, or how severe the problem is. Typically, 60% of the yellows need medication management. So they will put you on statin or a blood thinner or a any similar drug, which continues and you continue. But if you're on the higher yellow or the red, it definitely means that you need to go into further diagnostics, which could be a 2D echo, which could be a cath procedure, which could be a CT, a heart CT, or in a lot of places, even a surgery. I'll give you guys an example, and it was shocking for me. At that point of time, this happened a year and a half ago. We set up a screening camp at the Hajj Pilgrim Center in Jeddah. So they typically, when you arrive, you have to report yourself and somebody and submit your details. We screened 1,600 people over a matter of 6 days. These are all pilgrims who have come from far and wide for their Umrah, right?
Right, yeah.
And in 1,600 plus people, we found 63 people with anomalies. Out of 63 people, 6 people were put into an ambulance within 72 hours. That's the danger. These 6 people may or may not have made it home. And that's when you realize, you're really face to face with a problem that prevails all around us, but most of us are completely oblivious about it. Yeah. Does it answer your question?
Yes, it does. Yes, yes. I also have a nursing background, hence my interest in it as well.
Okay.
We can connect offline, yeah.
Right.
So I think we have time maybe for another question or so, if there are any. Please speak up if you would like to, or raise a hand and Patricia can make you join the conversation. And if not, then I would like to ask Ravi. Ravi, you have especially underlined the fact that there has been sort of a time before and then many things change. So for me, I think what's interesting from your story is what were the most biggest learnings, maybe inspirations, but learnings definitely from this crisis that you have taken forward, or your team or your organization?
Yeah, a couple of things. For one, we always thought that given the fact that we had all the machines and the labs, we could never work from home. And that it would be a disaster if we were to even attempt it. But now I can say with a fair amount of conviction, saying that work from home is certainly a possibility. And we can be as productive, if not more, and save on the travels in Bangalore. We can save at least on an average about 2 hours every day. That is one. The second thing is it brings in a very different sort of an emotional connect with the family. Because all the while, given that you are away in the office, and given the pressures that we have, there's hardly a chance. We never get time to spend as closely with the family to understand them and emotionally bond and connect with them as ever before. So that's been a positive for us in terms of this having come the way it came in, sort of a thing. So from that perspective, I think these are the 2 big learnings for us I would possibly want to take. One is connecting with the family, getting a lot more closer. And the third one is once you're away from the social fabric, the want for the social fabric increases like never before, sort of a thing. So that also brings in a very different sort of a connect in terms of the entire ecosystem and in terms of the group that we work with and interact with. So all in all, it has done wonders for us. Let me look at it from a positive perspective.
No, definitely. I think when I called up the telecom company here to complain that my Wi-Fi wasn't working or something, we had a very friendly conversation.
Yeah.
Everyone asking each other and, being as though we were friends. So it has done things to us, this whole thing. So Shankar, from your perspective, what has been or from TCS's perspective, what has been the big learning? And you already mentioned 25 by 25, pivoting the organization to work from home, in fact. But what else would you say has been the biggest learning?
Right. So I think I broadly agree with whatever Ravi just mentioned. I think the fact that we can do it, even though we never tried doing it, I think that's been definitely a learning. But I would like to talk about this whole thing about having a purpose, because I think one of the biggest learnings, at least for us, was the fact that when we looked at a research and innovation response, there was no need to respond, the way we did. But I think, when we looked deeper into why we had so many people trying to contribute so selflessly, because one thing that I'd like to tell everybody on this panel, this is the first time we are talking about it externally, right? we have never spoken to media about this. In fact, any whispers about this in the media have been to the pre-publications that we have put in, these document archives, where we actually release research papers to the scientific community. So journalists have actually picked some papers that we have put from there and have started coming to us and asking us, hey, what is this interesting thing that you're doing? So therefore, the question is that why would anybody do this? And I think, the realization that came to us is because of, the lineage. I think the Tata lineage is something which, builds that culture of, sometimes, responding to a call selflessly, even though there is nothing, no personal glory at the end of it. I think that's something that sort of reinforced the culture that we are trying to build within the company, and sort of gave us a quick litmus test that we're on the right path. So that was one learning. I think from a personal front, Vidya, I think a lot of us have learned. A lot of us have become extremely good at mopping floors, cutting vegetables while taking an office call. A lot of my colleagues have told me that they have discovered their spouses. I think for the first time they've known that what it is to live like a ordinary family, where one spouse is not jetting around or the other spouse is not jetting around. We've rediscovered our children, and I think from a MEM perspective, I think I've learned this, that when you realize that you have said all that you have to say, you just make a face like this. That's your connection drop face. That's your connection drop face.
Blame it
and nobody would realize that you're still on.
Thank you, Shankar. I'm very proud that you chose NICCT as a forum to talk publicly about some of the projects that you don't even talk to media about. So thank you for that.
I think just want to put on record, Vidya, saying that the Tatas have done a phenomenal work for India over the years here. Nobody can take it away from them. Thank you, Som, and your leadership team for what you have done. Hats off to you guys.
Thank you so much.
I cannot say anything but the same to Philips, to be honest. So thank you. Thank you for that.
Thank you very much.
I would like to then close now with the same question to iMedRix, to Ashwini, and then we can go into a free-for-all discussion, just continue as long as we want to. So Ashwini, for you, the major learnings, because your world has suddenly changed to you being in the center of what seems to be the demand of tomorrow.
Yeah, you're right, Vidya. So while, like Ravi and Shankar said, there's a lot that has happened for all of us on the personal front. I think it's enforced our resolve to actually see what's going out there, and people even who are happy and well, and we are fortunate and blessed that we haven't had any mishap in people or family or people close known to us, but there have been things that we hear of from our distant contacts. And I think our goal probably would be that I think they're close to about 1.5 or 1.6 million clinics in this world, general estimate. I don't know how much we can reach in our own plans and what all will it take. This is all a very collaborative effort. And you'll be surprised that even in Western countries, a lot of these community clinics are not geared up for diagnostics. So I think what we are looking to now is at least reach out to 25-30% of that 1.5 million as quickly as possible. And, really impact lives, because it is not, while it's a lot about technology, if you ask me, which is true, right? Because that's the core engine, but it's the use case and the cost of doing it, right? Which is where the real disruption comes, right? I mean, I can tell you as an example, the process that I explained to you, a typical ECG acquisition and review and reporting by a doctor, you'll be surprised, in Kenya, is almost as much as a week's food for the family. So why would anybody want to get preventive done for $20? We are doing it for $2 now. So the point is, it is not just for technology. It is not just about saying, oh, you did something brilliant. It is about people who actually need it are unable to afford it. And that's where you hear that somebody just dropped it overnight because there was so much going on they didn't know. So I think from our perspective, I mean, we always were, I think DNA is all looking beyond the storm, right? That's how all of us are together. And the fact is that we realized that the speed we were at, we probably have to put 20x to it now if we really want to make a difference. And that's what we're all going to work together. Obviously, we need help from everybody, including, the support of NICCT type organizations and governments and everything. But I think there is no looking back for us to make sure, and which is why we want to enhance the product to actually capture the comorbidity, which is hypertension, diabetes, because a lot of people don't know that diabetes also causes heart wall damage at a certain situation. So we're trying to now gearing up to get up together and make sure, we know we can't change the world, but we like to make as much difference as possible and save lives. I mean, my personal agenda, we're saving 8 lives a day. I think it should probably become 8,000 lives a day as soon as possible. I mean, that's where we'll see we've done a good job. Yeah. So thank you so much. Yeah.
Fantastic. I don't have anything else to add to that. And iMedrix, we'd be very, very proud to have you in the Netherlands for sure.
Oh, so, all of us. Thank you so much.
Yes. To close, I'd just like to hand over to Edith, our chairman, to close off. And then if we all have time left, then definitely most welcome to chat on a bit. Edith, over to you. Thank you very much to all the speakers. Sorry, Edith, for agreeing to spend your time. I know it's late in India, so just a couple of minutes more. And really my personal thanks to you to share this amazing story. I've learned a lot. Thank you again.
Well, thank you, Vidya. Thank you to our wonderful speakers, Shankar, Ravi and Ashwani, for sharing your views and your personal stories behind it as well. If I look at it and if I think, what are the findings of what we did this afternoon with this session, then I come to a very interesting conclusion, and I would like to just step back a bit and see that 3 months ago, this COVID-19 hit the world, and what the world did is we all went into lockdown. Nobody would ever have thought that political leaders worldwide put the human being and the health of human beings on the first place above world economy. I mean, let's be honest. So not one country, all countries locked down and put the health and the well-being of humans on top and let the economy wait for the next step until most of us were safe. So I would like to suggest to also see what all your companies, fine companies, are doing. Philips, TCS, iMedrix, and all the other fine members here. I think we could summarize this all this afternoon into one slogan worldwide, and also here on this forum: we care. And this is what it is all about. Thank you all very much. And
can't agree more with you, Edith.
Thank you, Edith.
Can't agree more with you.
Thank you very much. Well summarized.
Well said. Thank you.
So who is competing for the title of Mastermind NICCT?
You.
Eric, I think we should have you in the next pub quiz.
Yeah.
Which is in 7th of August, I think.
7th of August.
Yeah.
Yes. Oh, sorry. I forgot to tell everybody. Sorry.